Hi, my name is Ann Schmidt. I am a certified dental technician specializing exclusively in partial dentures for over 25 years. Today, I'm going to show you how simple it is to make a flexible partial out of FlexStar using our Nobilium flexible injection equipment. To get started, we are going to draw the design for our flexible partial on our master model. It is not necessary to use a surveyor as with a conventional partial framework. Most cases do not have to have a parallel path of insertion due to the flexibility of the clasps and major connector. In order to stabilize the partial from anterior movement or twisting, the major connector should not be too narrow or thin. When designing your FlexStar flexible partial, it is important to consider aesthetics. We are now ready to do our blockout wax. We only need to block out gross undercuts, areas that will prevent the partial from being inserted or removed. A surveyor is not necessary. Any non-flexing undercuts will need to be blocked out. Be careful. Too much blockout relief can cause your appliance to fit loose. Now that the proper undercuts have been blocked out, I will duplicate the model. Use your normal method for duplicating models. I will use our Nobilium hydrocolloid material and a Nobilium duplicating flask. I am then going to cool our poured duplication. When the hydrocolloid duplication is chilled, remove your master model and fill the mold with model stone. This duplicate model will be used for processing our FlexStar appliance. We recommend you articulate both the master model and the duplicate model. Set the teeth on the duplicate model. You will need the master model articulated after finishing, though, to check the occlusion. When setting the teeth, use a small round carbide burr to create mechanical retention or diatorics in the teeth, from mesial to distal and connected to the center diatoric hole. There is no chemical bond between the teeth and FlexStar, so it is important that the FlexStar material be allowed to flow into the diatoric holes and other mechanical retention that you may want to make. Also, when setting the teeth, it is important to allow at least 1 millimeter space under the teeth to allow FlexStar to flow to the labial or buccal side and into the retentive diatorics. We do not recommend using a baseplate. After the teeth are all set up, I will wax the rest of the appliance. It is important to wax the flexible partial with anatomical features that you will want in the finished case. Technique for waxing is more like waxing a metal frame than a denture. Do not apply too much wax and expect to easily finish the case down after processing. FlexStar is more difficult to finish than conventional denture acrylic. Note the wax up of the clasps. Most of the retention is on the tissue, unlike the clasp of a metal framework. Be careful not to wax the clasps too thin because they will not have enough retention. Do not add too much wax. You will be sorry when you get to finishing. Here is the finished wax up. Waxed up anatomically with its final contours. We are now well on our way to the investing and injecting of our FlexStar flexible appliance. Here's our completed waxed up duplicate model alongside our Nobilium flask. Let's get started investing. Use 100% dental stone to invest the case, not a plaster stone mix, as you will need the strength in the flask. Always use a vacuum mixer to remove bubbles that can lead to defects. Apply a layer of Vaseline to the inside of the flask for easy divesting and cleanup later. After mixing the stone, carefully pour stone into the bottom half of the flask. Place the model in the center of the flask, aiming the posterior portion toward the sprue opening. This is the area where the FlexStar material will be injected. Smooth all surfaces, eliminating undercuts, so that the flask will be easy to open after the boil out. After the stone is set, use 2 sprues from the flask opening to the most posterior portion of the wax on both sides. Sprues should be approximately 7 millimeters in width and red or white in color. Do not create sharp angles with the sprues, as the heated resin must flow in a straight or slightly curved path. Apply a thin layer of Vaseline on the entire stone surface. We will then close the flask so that we can invest the top half. Carefully pour your stone into your flask under vibration, taking care not to incorporate any air bubbles. Now we will let the stone set up for at least 45 minutes. The next step will be to remove the wax. After the stone is set, place the flask in boiling water for 8 minutes. Carefully remove the flask from the boiling water. Open the flask and wash out the wax, making sure all wax residues are eliminated. Allow the flask to cool. If any of the teeth have been displaced, use a small dab of Elmer's glue on the incisal or occlusal surface of the tooth to tack it back into position. Apply thin layers of Noble Shield separator on the entire surface of the stone and allow it to dry completely. Do not apply separator on the teeth. When the Noble Shield separator is completely dry, close the flask.